of the day. Welcome to Physio TV, all of y'all. Today we are going to talk about a very interesting topic, that is financial management. The speaker that we have with us is none other than Dr. Apurva Shimpi sir. He is a principal and professor of Sancheti College of Physiotherapy, Pune. He is also a chairperson of IAP Research Committee for West Zone and also a treasurer of 49th IAP Conference, Pune. He has keen interest in financial domains and the achievements that he have achieved and the way he manages his financial aspects. He's going to discuss with us so that we as physiotherapists can actually kind of take a lot of guidance from here, how we can plan in future. Please, Dr. Apurva Shimpi, take it ahead from here.
Sure. Thank you so much, Dr. Jaspreet, for the kind words and the introduction. Greetings, everybody, and warm wishes from Sancheti Healthcare Academy. Well, this particular topic on need of understanding financial stability for physiotherapists is something very close to my heart, and we have often been discussing it with many of our students, fellow colleagues also, because always whenever we talk of our professionalism, we are very good doctors, we are very good therapists with a lot of education on diagnosing, treating of patients, cases. We are very excellent with this. But when it comes to handling finances, may it be personal or professional, there are a lot of confusions that many of us have. I'm not generalizing this because there are many physios whom I know are wonderful with this, and I take a lot of inspiration from them. In fact, from this platform, I would like to make an appeal that if any of you also finds this topic good or is interested to contribute to this particular domain, wants to have a better, inputs on this particular domain, please feel free to write to us at physiotvofficial@gmail.com, and we will definitely have a component by you. So when we talk of finances, finance is something that, we all are a bit often scared about, because when it comes to money, it's just discussing on with things and okay, so that's getting, yeah. So when it comes to money and when we are talking about a lot of factors, sometimes we all become quite a lot skeptical that what exactly are we talking about, and money at times can be a bit scary decision for all of us to make. But the entire objective of this particular session is just sensitizing all of us physios, especially the younger practitioners or the population, on understanding some components of money which you need to understand at personal level and at professional level both. So in this session, we'll be dealing on a small aspect especially for the would-be clinicians, and also on some aspect related to your personal life or how you can work on your money balance also. So let's go ahead with understanding toward the financial stability and well-being in physiotherapy. So first and foremost, why do we need to know this? Why is there a need for us to understand money? See, it was quite a personal experience, I would say, that when I had become a physiotherapist and started working clinically, doing home visits or so. Your diagnosing, treatment, everything was wonderful. But when it came to asking money, you know your worth a lot. For example, let's say you think this was a challenging case with 2-3 complications, and you should definitely ask for at least 1,000 rupees for this session. And suddenly you start feeling 1,000 is a bit more. Let's come to 800. I think 1,000 I should not ask. Then you go at the patient and you feel, nahi yaar, I mean 800 puchu ki nahi, I don't know. Let's come to around 750 or so. And when finally the patient says, okay, doc, that was a good session, and how much do I owe you? And you want to say 750 and you say 500. I mean, how do you really come to this particular decision? First and foremost, that you want to charge 1,000 or 500? How is it that therapists around you are charging something like that? Or is it that you are underweighing your own professional domains? See, there is a huge debate on this particular topic, and I think it would be wonderful to have such a debate also in this platform as to how much physio should charge on a professional domain. But one thing I have really understood, that as physiotherapists, we all underestimate our own selves. This is a fact. Because we as a healthcare professional are worth a lot when it comes to understand how much the patient has to pay to bearing his disability or inability to a lot, the suffering and the costs involved with it. As a physiotherapist, what you are offering him, what you are giving him is worth a lot. So there is nothing wrong with asking for a good financial domain. And again, mind you, it might be a lot. It might be depending on the investments that you have made towards the therapy, the equipments, the modalities, a lot of factors. So it is your right to decide what sort of finances are you expecting from your clients. There are people who will say, why are we talking of money? I mean, money is not important. We are here to serve others. I am here to serve others. Why not go to them in a BMW or an Audi? What's wrong with it? If you are talking of maintaining the higher standards towards your own professionalism, why not showcase your profession as something which is good? Why should everybody imagine a physio coming only on a two-wheeler and other medical practitioners coming in there? Because don't we have that equal right to grow? So how do you grow? The understanding finances is a very, very important domain when we are talking from physiotherapist perspective. What are the common hindrances that we get to hear? Finance is complicated. I don't know it. Mind you, you were amongst the toppers who scored huge marks in your 12th and NEET and everything to get admission. Do you really think you cannot understand finance? At least basic domain in it. Yeah, second thing, I don't understand money. Who does not understand money? Or we all have been learning to handle money right from our childhood. Many a times, we say my CA will look into it, or many of the females, especially with all due respect, say my husband or my father will look into it. Why? You have a right to knowing your own financial status or health in a better way. Some of you might say, I don't care as long as I'm earning. Fine, good. I mean, we all are well wishes for you. You should earn a lot more. But then how are you utilizing it? Is somebody misusing it? For let's say you have your own clinical practice and you're employed 4 physios with you. You have your receptionist, don't you want to know where your finances are going? Is there a drain or a loop in your finance? You should understand this. I don't want to live like a miser. Why do I really need to look at money every day? It's okay. Knowledge about money is not a crime. I have my own standards. Okay. Many of people will say, no, I want to live the way I am living. I don't know. I'm not interested in all these things. I have heard people actually say, and surprising to me, many of the younger population now, they are very different in this. We had, my time, people saying, I'm very young or small to learn whatever money and everything. And I'm so impressed with the current generation who actually knows, they are understanding the domain of finances very well. In fact, I have few of my students, in fact, our host for today, Dr. Jaspreet, a young and dynamic physiotherapist, is also very good with her financial management and knowledge of shares and everything. And I'm very sure maybe next time she is the one who's going to take a session for us on financial domains. Some people have this domain. I am unmarried. It doesn't matter to me. I'm earning, I'm spending it. ये झटका बाद में समझ में आता है when you actually have a family to take care of and you realize there are absolutely no savings, that you have. And with the current economy going up and down all over, having a good amount of saving is important. And we will talk of saving where. Rather, I should not use the word saving. I should use the word investment. So we should talk about investing where. Some people always say, क्या पैसा पैसा करने का? Nothing wrong. वो as they say कि, माना कि पैसा सब कुछ नहीं, लेकिन पैसा कुछ भी नहीं, ऐसे भी नहीं है. There is no money who has seen a dustbin, a note that has seen a dustbin. It is important to understand finance or money in a definite way. So we have some basic questions for everybody. And when I am asking this question, maybe you will ask this question to your own self also. On a scale of 1 to 10, where 1 means very low and 10 means very high, how would you assess your own financial knowledge? Some of you may be at 10, definitely. And again, I appeal to you, if you know, please come and share with us, with your fellow colleagues. Let people also know how they can be as good as you are. But for the people who grade themselves at 1, 2, 3, I think this talk is definitely for you, and you should really, kind of listen me out. Suppose I ask you something as simple as, let's say you have 100 rupees in your saving account and the interest rate is 2%. After 5 years, how much do you think you would have in the account if the money you have left to grow? So let's say I say more than 102, exactly 102, less than 102. What would you grade it? So you have 100 rupees, you have 2% rate of interest. Okay, my common sense says 102. But then there is something called as a compounding rate of interest also. That is interest on interest. So when you have 102 rupees in first year, now the second year, you have 102 rupees on which the interest would be charged. And definitely the amount will go on cumulatively being more. So the amount that you have, understanding the domain of compounding interest is very, very important. For example, many of us have taken EMIs for our homes, for our clinics, for our education, and they charge varying rate of interest, maybe from 7% to 12%. So please understand that there is a compounding rate of interest on all these domains, and hence clearing your EMIs on time, or sometimes best is to clear your loan amount on time or before time, will save you a good amount. Again, there are controversies to it, that whether you can use that money for something else. So maybe if you are using it or you're earning more than that amount and you want to invest that amount into something better, which gives you more. Example, your home interest is, let's say, at 8%, but you are able to do an investment or save it at somewhere around 10%, then of course, investing in that 10% would give you higher yields than putting in your home account or EMI. So whatever I'm taking is with a pinch of salt. But if you are wanting to keep this money in, let's say, your saving accounts where you are getting at hardly 4% rate of interest, might as well put it in your home loan or EMI account or education account, wherever, which will actually help in cutting down on your EMI. So understand these basics. That's all is the expectation from this session. Then question like, imagine that the rate of interest on your saving account is 1% per year and inflation is at 2%. So after 1 year, would you able to buy dash of today with the money in this account? So what? More than, exactly the same, and less than? I'm very sure, common sense, all of us know that 1% is the rate of interest, but inflation is 2%. So definitely I'm going in a loss. So at the end of 1 year, I will have less than what I have put in my account because inflation is actually higher than it. Okay, so are we aware of what is the current rate of inflation of India? Find it out. Excuse me, it's worth knowing. Do you think the following statement is true or false? Buying a single company stock usually provides a safer return than stock mutual fund. What do you feel it is? Excuse me. So you're going only for a single company versus. So again, when you are talking of investments, there is something like a depth investment, which is kind of safe to a high risk investment. And most of the investments give you option of whether you want to have a safe or a depth investment, a moderate type of investment, or a high risk investment. So if you have X amount, let's say you want to invest 100 rupees, always think depth investment is definitely going to give you a fixed value back, but the margin of the component might be lesser. High risk investment is going to give you a higher return, but there is a lot of risk associated because the money is going to go up and down. If you have a financial advisor with you, a colleague, a family member, or a friend who can guide you onto this better, always get some advice from them. It is better to know, spend your time, because generally it's like a common example when there are some people who are coming like this and they are giving you advices on finance. You're like, please try and understand, because however not interesting that it may seem, these are actually going to make you things understand things in a better way. Yeah, that don't know was for people who just say like, I have no clue what this is all about. So it's okay. So again, do you think the following statement is true or false? A loan for 15 years period has a higher EMI than a loan for 30 years period, but the interest paid over the period of the loan is lesser in 15 years loan as compared to a 30-year loan. Of course, if your duration is lesser for the same amount, the EMI is going to be higher. So if I am taking, let's say, 10 lakhs for 15 years versus 10 lakhs for 30 years, the EMI that I'm going to pay for 15 years would be higher as compared to 30 years. But the interest that I'm going to pay for the amount at end of 15 years will be lesser because I'm clearing the amount faster. So if you can, please try to pay the EMI. Again, a small tip for you. Generally, what we tend to do is you have an EMI and let's say you can afford to pay more. People tend to change their EMI amount. They may tend to increase their EMI. Don't do that. Keep your EMI the way it is and pay top of value. Because from your EMI, a large proportion goes for your interest and a small proportion goes for your principal amount. Principal amount is the loan that you have taken and interest is the interest on that amount. When you pay directly in your account, in your loan account, for example, your principal amount gets deducted directly. And that small amount can even be 500 rupees. So what if your loan is of 10 lakhs? Even 500 rupees will make some change in your principal account. So have a habit of putting in some top up money in your EMI account always. And that can be up. So let's say your EMI is for the 10 lakh is let's say at 14,000, 14,000, and you have some additional income. Let's say you have done 2 PPs, 3 PPs, and you have some 1,000, 1,500 rupees additional at the end of the month. Put it in your EMI account, because directly it takes care of your principal amount rather than only the interest. So have this habit of putting in small top-up amounts in your EMI. Most of the banks will not have an objection with this. They have an objection for early foreclosure. And there is a kind of a small secret for going for a foreclosure without going for a huge penalty. Okay, which is not going to be discussed over here right now. But please understand, if you're going for a foreclosure, try and minimize your amount. That would help to put a lesser penalty on the pending amount. I think that I have kind of spelled out the secret also. Okay, again, do you think the following statement is true or false? Interest on fixed deposit is taxable. True or false, or I don't know. Well, please understand, FDs are also taxable. Well, many of your banks will give you an option of tax saving FD also. They might give you an option of an higher investment with tax benefits, or you will also have an option of a tax saving fixed deposit. Most of our commonest fixed deposit that we operate from banks, even their amount in your fixed deposit is also chargeable. And because it is all linked with your PAN, you can't hide it. Okay. So please understand that your investments are also charged until and unless you are going for a tax saving account. So many of us would like to know a bit on shares and all. So we say that there is an account which is known. So I don't know if all of you are aware of this. Maybe most of you are. So if you are looking to invest in shares, can you do so from your saving account or current account? Well, not really. You need to have a demat account for it. And many of the banks will help you even with opening for a demat account. It's a dematerialized account to go with your shares or investments. And I'm very sure Dr. Jaspreet will take a good session on us later on going for investments and using a demat account, and how we can go with bonds and
Definitely, sir.
so.
Definitely.
Sure. Thank you, ma'am. So trying to understand these domains are very good. So maybe I'm just bombarding you with a lot of questions, but that will help us understand what kind of money investments and finances are all about. So one more last question, maybe. If you buy a company's bonds, you own part of the company, you have lent money to the company, you are liable for the company's debts, or you can vote on the shareholder resolutions. So again, as I said earlier, we need to understand the difference between a bond and a share. So are you owning the share of the company, or are you owning the bond of the company? Because when you're owning a bond, you're kind of lending money to the company and getting higher interest for it, as against share when you're trying to own a part of the company. Okay. So kind of understand there's a difference, and people, when we don't know the difference between this, somebody will come to you and say that, "Arey, ye company ke bonds nikle hai and they are very good and you have to buy." And we are like, "Oh, I'm making an investment in the share market." It's different. A bond is different and a share is different. So try to look into that. Always make savings a priority. So it's said that a stitch in time saves nine. If you can actually, there are a lot of sayings actually. A money saved, a penny saved is a penny earned and all. So if you can save better, it is always a good habit. So how do you save money better? You can cut on your area of expenses. This is easier said than done, because with the current lifespan, we are spending on our cables or our Wi-Fi, OTTs, electricity, phone. We want to buy a new phone every time whenever there is a new model come. We want to go to the best of the restaurants, eat out. We want to watch a lot of OTTs. Okay. Again, see, maybe they denote the standard of your life. I'm not asking you to compromise on standard of your life, but okay, let's say you are going for your cable. You are having XYZ cable TV with you. It might be Tata Sky, Airtel, whatever it is. It's all are good, all are very good services. But what channels do you really watch? And most of these give you an option of choosing specific packages which you really want to watch. Do we really look into it? How many of you look into it? Okay, what is the package that you have and what are you spending on it? Because if you can selectively choose what you want, you can actually save money even in this. Lifestyle, going for shopping, eating out, again, nothing wrong with it. Spend time with your friends, spend time with your family. But can you cut it down? Can you limit it? Can you restrain yourself to times when you really want to go it? Buying things of brand. Okay, again, nothing wrong with buying from a brand. There's something good. It can denote your standard and quality. People will come to know, "Arey, bade brand ke kapde pehenta hai." Whom are we trying to show off? Do you really want it? And if you do you really want to have a iPhone 10 and iPhone 11 and iPhone 13? Okay, if you just, why you want to show it off, or is it of value to you? If it is of value to you, because even today the phone that I am using, I don't even think I'm using 80% of its features. Do you really want just a phone to show off that I have this phone? How much is it of a utility to you? And if it is not of utility, trust me, you're wasting your money. So if you can think on these domains, I think हमारे कल्चर में जो हमेशा बोलते थे कि चद्दर देख के पैर फैलाना चाहिए, इट वाज नॉट रॉन्ग. ओके, अभी ये भी बोलते हैं कि ठीक है, फिर बड़ी चद्दर ही खरीद लो कि तुम्हें चाहिए वैसे पैर फैलाने चाहिए. ओके, वंडरफुल. So buy a badi chaddar and still try and look at how you can fellowfy your legs on it. So always ensure that your income is higher to your expenses. Then there is impulse spending. Okay. For example, if you are this we are all loving to do always. You go to a cloth store and it is offering you buy two get one, or buy four get three. What do you want to do? So do you want the buy two get one or buy four get three? How many did you want to start with? One or two? If it is one, just buy one. Why go for two to get three? You never wanted three. Okay, if you want three for that matter and you're getting buy two and get one, good. But why go for four then? Because please understand, these are all marketing strategies to just stimulate us. कि अरे एक free, see, free मिल रहा है. There is no free. There is nothing free. Then buy two, get one free. That one is never ever free. You are already paying for that one when you are buying these two. You're already paying for it. Or buy four and get three more, or whatever the offer is. You're paying for each and everything that you're buying. It's just the cost that is put. I'll show you, I'll tell you a very small, cute example. I had gone to a shopping mall at one time, and that was before they had to start a season sale. And there's a jacket that I like. And the cost on it was some 700 rupees. So I was like, okay, 700, but I know that they were going to start a season's offer in a few days. So I said, I'll just wait to get that offer. And then once they start the offer, I'll buy it. I came back in a couple of days to look at that same jacket, no change, okay? And it was written at cost 1000 rupees, 200 rupees discount. And the sale was at 800 rupees. What we all see, we see that 1000, that cross on the 1000 at 800. Arey wah, 200 rupees ka faida. Boss, that was for 700. I am actually spending 100 rupees more for what it is. These are all marketing strategies and gimmicks. So please use your wisdom when you are spending. Don't go for impulse spending. Most of us, I've heard of people saying ki, when I'm stressed and I'm tensed or I'm panicked, I go for shopping and that makes me feel better. भगवान आपका भला करे, आपके वजह से इकोनॉमी चल रही है. I can bless you, nothing other than that. Many a times we hear a word, a very cute, beautiful, exciting word, and then we love to respond to it. Sale. Again, trust me, there's no sale. The cost, I just gave you an example right now. There was no sale. 700 की चीज 800 को बिकी, मुझे लगा 200 रुपए कम करके आया है. Of course, I didn't buy it. But understand, we get panicked when we just hear this word. And again, as I was saying, when you are deciding to give somebody, okay, most of the times we just want to show the cost. ये इतना महंगा gift तुम्हारे लिए ले. Maybe all of you have heard that 3 Idiot का thing when he is buying Karishma that watch, 4 लाख की घड़ी खरीदी घुमा दी. जरूरत क्या थी? Was it really necessary to buy a 4 lakh की घड़ी? But you want to show off. Many of the times you want to show off ki dekho, my love for you is based on the cost of the things that I'm buying. What about the utility? See, the relationship is more important. The time that you spend for that person is more important than the amount that you are spending just to show that you love that person. Is it really needed? Utilization is more important. Your time is more valuable than the cost of the items that you are buying. I'm not being a love guru. I'm just talking on finances. That's all. Okay. We all have moved to the cashless zone. No, we pay by GPay, Paytm, and all other domains. So what would you prefer? Paying 1000 rupees in cash or 1000 rupees by maybe any of these modes, or maybe by your credit card? I love my credit card. It gives me cash back. Why? Why would my company, my bank, give me cash back on the money I'm already spending? They are doing charity for you. They are using your money. They're charging you for a lot of other things. Whenever you are using GPay or Paytm, there are costs per transactions, because 1000 rupees moving around in 10 people and coming back still remains 1000. But 1000 rupees moving around with 10 people on any of these online domains actually is charged. And finally, you don't pay 1000, you actually pay more than 1000. Check it out. Check your Paytm or GPay statements. Go for your annual statements and see whether you are charged for something. Why would they give you cashback offers? Why would, we love it when we get that message from GPay, 30 rupees cashback. Are wah, GPay se paisa mila. Bhai, they took your money and they are paying you not even 1% of what they have taken from you. Please understand these domains before you really talk of it. Again, I'm not against online transactions and all these things. They have proved to be a boon for all of us in the COVID and post-COVID era. But wherever possible, try and pay by cash if you have cash. If not, okay, go ahead and pay by online domain also. Whichever suits you. Again, the choice is yours. Then evaluate your expenses of what you have spending. I'm just showing you a crude example of a family budget that I have made. And this might sound to be a bit scary, but trust me, it is not. So if you look at it, and if you can see the laser pointer here, I am looking at two domains. One is income, one is expenses. And this is the financial budget. So of course, it starts with April, May, June, July, August, September, Jan, March, and then the total cost on it. So these are my approximately incomes to it. Don't look at the amounts. They're just for example for you to understand the money part of it. And these are, for example, the wages of my wife. And maybe something investments that we have done or something. And I'm knowing what is my monthly income. Okay, for example, this is my monthly income. So this goes as my annual income. I hope nobody from IT is watching this and saying, okay, ye kya aa raha hai karke, but as I said, this is just for you to understand. Now, these headings are under the expenses. For example, whatever you are spending for, you have a vehicle, you are spending for your vehicle insurance, beauty parlor, barber, cable TV, some charity, you're paying for your kids, clothing, credit cards, electricity, entertainment, gas, gifts, groceries, insurance, tax, life insurance policies, medical dental treatment, some mortgages, home loans, rent, school fees, telephone, whatever. You may have more than this, you may have less than this. Try and have all these headings done. And this can be done very easily on an Excel sheet. Okay, this is not very complicated. It's a very simple Excel sheet. Now try and put amounts, or you can have actual amounts, or you might have approximate amounts on whatever is your monthly income on all these domains. Let's say you have a policy and you are paying only in August and November, and you may have some policy which is 4 times in a year. You might have something which you are spending only once. For example, you have vacations and people like me get only summer or winter. So we spend some amount there and some amount here. So you kind of know, maybe you can have property tax and all also if you're paying property tax for your clinic or your home or whatever. This is even good for your clinic. You can have a budget for your clinic. You can have a budget for your home also. The advantage of this is I know what is my monthly income. I know what is my monthly expenses. And I know whether I am in a financial credit or a debit at the end of the month. For example, August, my income is less, my expenses are more, and I'm in a financial debt. So August, I would think twice before booking a movie ticket or before going for a hi-fi party to a restaurant or so. Okay. Again, see, don't get me wrong. I'm not saying that you have to live a lot like this. It's not that. But then understand your spending habits. I know where I'm saving. I know where I'm earning. Again, November, for example, my expenses are too high. So I'm having maybe a financial debt. And overall, at the end of the year, I'm having some financial savings on this. Okay. So let's say I'm having something. Now, it is up to me now to decide that this is my extra money. This is my extra money. So I can actually plan what I want to do with do I want to utilize this somewhere? Do I want to put this in that financial crunch? For example, November के लिए मुझे इसका कुछ करना है. I want to pay a bit of top up amount for my EMI. I know how much I can put it from here. I know where I can save on my emergencies, because as I said, I'm saving on, I'm putting in health insurances and some investments. Let's say you have some policies. So it gives you an idea of where you want to invest what amount and how much you kind of say. See, other, you have options. You can add things. You can add more things. You may have other sources of income. For example, as I've put here, FDs, or you might put some money in some components which is giving you a higher rate of interest or something of that sort. So you might have some amount here. So A, आपके पास ऑप्शन है बड़ी चद्दर खरीदने का यहाँ, या आपके पास ऑप्शन है कि चद्दर देख के पैर फैलाने का यहाँ. आई एम गिविंग यू बोथ दिस ऑप्शंस इन दिस. Okay. Yes, go ahead and increase your income. How to increase your income, I'm going to tell you later. Or save up if you don't have, if you can't increase your income. Or you can do both. I mean, it would be wonderful, right? Again, you'll say, फिर इतना पैसा बचा के क्या? Again, use it. I'm not saying don't use it. Money is for you. It's your money. Use it. But now you can use it fairly, wisely, and you know what is the worth risk that you can take. At least that you will understand with this. Always invest in your future. Okay, live your present, enjoy your present, but invest in your future. So whatever income you are getting, please ensure that at least 50% is spending in investments. Okay, spend, it's worth it. Spend at least 50% in investments. Investments can be pension plans, public provident funds. Okay. Pension plans give you a good benefit, because many of us in clinical practice or in jobs may not have pension after retirement. This will take care of our medical needs also later. Public provident fund is very good. You can save tax on PPF income. Then insurance policies. You might have medical insurance, life insurance, vehicle insurance. Again, it is an incremental cost. It generally, but it is always safe to have that, because something goes wrong, you can always save on this. Always have a PA policy. PA policy is a personal accident policy. See, insurance policies, let's say, God forbid, you had a fall or an accident, you had a trauma, and you are admitted to a hospital, and the overall expenses for your accident are, let's say, around 4 lakh. Your insurance will take care of that 4 lakh rupees. But then for 3 months, you are out of service. You cannot go to your job because your leg is injured or so. What happens to your salary for those 3 months? Maybe you are using your sick leaves. Maybe you are in your own clinical practice. You can't go to your clinic. What would you do? PA policy pays you your daily income. For example, let's say your monthly income is 50,000 rupees. No, let me be a bit easier for me to calculate. Sorry. So let's say your monthly income is 60,000 rupees. Your monthly income is 60,000 rupees. That means approximately you are earning 2,000 rupees per day. So what PA policy will do is, if you are after discharge, let's say you are at home, you cannot go to work for 2 months. It will give you the salary for these 2 months. So apart from your medical incomes, there are things which medical policy might not take. Dawai, yeah, family ka kharcha, cable TV, EMI, something you will be spending on some domains. So PA policy, the personal accident policy, will pay for some of this part. So it is not a very stressful situation for you. It will be, you will be able to spend at least, you will get some part in your hand when you are going to. So, and please remember, these are government companies which are giving these policies, and the EMIs are very nominal, very nominal. So I actually urge all of you to go ahead and take your personal accident policy. भगवान करे आपको उसका यूज ना हो, but हुआ तो always be safer. It's like the medical insurance we say, भगवान करे उसकी नौबत ना है, but better be safe than be sorry. Same way PA policy is also there. Then indemnity. Now this is mandatory for all of you. How many of you have an indemnity policy? You are a clinician. Oh, you will say, no, I am working in a hospital. Yes, you still need an indemnity policy. People like me, I'll say I'm into academics, but you are there in the clinics to treat patients. You still need an indemnity policy. What is indemnity policy? Indemnity policy covers you from compensations due to medical issues also. So for example, you're treating a patient and your US ultrasound machine got shot and the patient got a shock, and the patient sues you कि ये physio के वजह से I got a burn, and what do I do? And what do you pay from your pocket? Indemnity policy gives you a coverage to ensure that such hassles are managed from it. Again, as for PA policy, the premium that you pay for indemnity policy annually is a very small amount, very small amount. For PA policy, it will directly depend on your actual income. For indemnity policy, you get to choose. How much indemnity do you want? For example, you want an indemnity of 5 lakhs, 50 lakhs. I think in physiotherapy practice, up to 5 lakhs is more than enough, more than enough. We really don't need to have a policy beyond 5 lakhs. But there might be time, for example, a surgeon handling complicated cases, something goes wrong, can be sued for a larger amount. Maybe for them, having an indemnity policy of 25 to 50 lakhs is also important. Indemnity policy is up to you how much you take. PA policy is totally dependent on your monthly salary, also annual salary. You cannot choose your PA policy ka premium or amount, but it's very less. But for the indemnity, you always have a choice. So for all you clinicians, I know you're doing successful. God bless you. Please take an indemnity policy. Again, these are issued by many of the government agencies like Oriental Insurance or New India Assurance or things like that. So they are not private bodies, but ensure that you are doing that. Then investments in property and in gold. Yes, this is also a very good option. Gold at times might not be a very good secure domain because, of course, if you are wearing it, especially in our culture, females tend to buy a lot of gold, but it's a good investment. I mean, our culture itself is such a way that you're actually making a good investment. But sometimes maybe you're not interested in actually buying gold because kahan rakhne ka, ghar pe, then again there are associated risks of it. So maybe you can buy a sovereign gold bonds. Gold bonds are having the same value as of gold. You can sell or buy it as to the actual rate of what the gold rate is all about. And we all know gold rate keeps on increasing. So gold bonds are also a good option. Or property if you can. Because property, if you are buying in a good place, you all know property ke rates bhi hamesha badhte rehte hain. So these are generally good investments. Property might be a bit high for a few of you, might feel like I don't have that kind of money. Go for gold investment. When you have good amount of gold investment, invest it in the property. You can always, but please take a consultation from somebody who knows the component deeper. So don't just go and buy because I have said so. Consult your financial advisor, talk to them, let them tell you what is a good investment, and I think that would be better. FDs, as I said, FD is always a good option. FDs might not give a very high rate of interest, but it gives you a more better rate of interest as against your saving account. So if your money is in your saving account, better is to go for a fixed deposit. FD at a fixed deposit will be better. As I just told you some time back, there are some tax saving FDs also. You can ask your bank, or if you have an app, your bank app, it gives you options, look into it. Again, talk to your financial advisor about this so that you understand things in a better way. Okay, so you don't have that amount of money, let's say 50,000, 1 lakh, 5 lakh to put directly in a FD. Have a habit of going through opening a recurring deposit then. So let's say you can save 1,000, 2,000, 5,000. Try and put it in an RD. Of course, there are other options also. Again, I'm not saying these are the only options and you have to be limited to it. But if you don't and you want to be safe, because FDs and RDs are comparatively very safe. But you can have an SIP also. I don't know if the next point is of an SIP. If you don't want to, and you are a risk taker, you want to play it, you want to be a game man, go ahead, try for an SIP. SIP is equally safe. Okay. And it will give you a better yield as compared to fixed deposit and recurring deposit. Interest for a fixed deposit is higher than that of a recurring deposit. For an SIP is more better. SIP will again give you an option, as I told you earlier, whether you want to go for a debt plan or you want to go for a high risk plan or so. You can play around, you can mix and merge. Talk to your financial advisor for wealth plans. They are where you can invest rather than an FD. If you have some amount, you have wealth plans, and there are good wealth plans of company of banks like SBI, which is a government institution. They have good wealth plans. So if you can spend up X amount for maybe 3, 4, 5 years, they actually have a cumulative plan. So after 5 years of deposit, they can actually give you good net returns later. So always look at what are your options. For all of you, things might be at different ends. Think what works for you in a better way. And then might be some non-conventional way. Bachpan se hamare maa baap had given us a small piggy bank. The habit was the same: save money, save penny. That sometimes people do that also, that they have their ghar mein lifafa of keeping money safe, and you can do that. Or there are some padpedis and all also. Again, there are a lot of risks involved when you are going with padpedis. They might give you a higher rate of interest, but always the risk associated with that is more. Just understand one thing: जितना ज्यादा इंटरेस्ट आपको मिलेगा उतना ज्यादा रिस्क भी है वो अमाउंट के साथ. So whichever plan you are planning to, it might be an SIP, it might be a Padpedi, it might be a wealth plan. Whichever plan is offering you a higher rate of interest is always a high risk plan. The lower risk is a debt plan. Easy, you will not lose your money. Okay, so you decide if you want to take the risk, if you want to play it safe, but understand money. Don't say मुझे कुछ नहीं समझता है. नहीं समझता तो talk to somebody who can explain you these things.
Thank you for this great talk and a broad overview about finances in physiotherapy profession and how as a physiotherapist I can actually work on it. Thank you for walking me through it stepwise, and all of our colleagues through it stepwise. And we will be continuing with the second part of this talk next time. Don't forget to catch up with us on Physio TV next time for the continuation of this talk on finances and how you can have a more secured personal and professional finances stability as a physiotherapist in a professional career. Thank you, and see you for the part 2 of the financial stability and well-being in physiotherapy. Thank you.